Hello and welcome to this episode of On Geriatrics. Today we shall be talking about the role of the gerontological nurse, his or her role in the team. As you all know, the nurse does many things like monitoring of the pulse, temperature, blood pressure, respiratory rate, and other parameters, measuring the weight, waist hip ratio, etc. She does the nasogastric feeding, changing the nasogastric tube, catheter, injections, IV lines, etc. But what is special about the gerontological nurse? One of the important roles of the gerontological nurse is to check compliance. That is, whether the patient is following the instructions with regard to the medication as well as all the other instructions, the lifestyle instructions that have been given to the patient, whether the patient is facing any problems with that or the caregiver is facing any problems, and she tries to talk to them and address those issues. She plays a very important role in educating the older person and the caregivers on how the person has to be taken care of and what are the uh, things to do or not do in order to maintain health, because the nurse gets to spend a lot of time with the patient and the caregiver. Another important aspect of geriatric care is the caregiver stress. As you know, the older person may have many requirements, and the person taking care can sometimes get stressed because of this. And oftentimes, the caregiver is the spouse of the older person who himself or herself is old and sometimes suffering from many illnesses. So it's very important to look for any kind of stress in the caregiver and see how that can be addressed. But the most important role that the gerontological nurse plays is in the inpatient setting. Older people are at risk when they are hospitalized. That is why hospitalization should not be taken lightly. Two dreaded complications that can happen after hospitalization are delirium and cross infections. Delirium is a state where the older person loses his bearing. He becomes disoriented. He can become agitated or he can become unduly apathetic and not responsive to what others are telling him. This is a huge setback in the treatment because then he will not be able to follow the advice properly and everything suffers. So we try our utmost to prevent delirium, and the nurse plays the most important role in this. Delirium, I will be talking about in more detail in future episodes, but the causes for delirium, among the causes for delirium is undue stress that the current illness has brought about and the sudden change in environment from home to the hospital, which can often be very intimidating to the older person. Then change in medications may happen during that admission, and metabolic changes can happen during the illness, all of which can contribute to the delirium. So, what are the things that can be done to prevent delirium? So, one of the important things is the nurses see to it that there is a one-to-one nursing. That is, the same set of nurses look after this patient from admission to discharge, so that the patient, can form a good rapport with the nurses, and that is greatly reassuring to them. Having a close relative or a friend with the patient is also greatly reassuring for the patient. And that is something that should be done as far as possible. What does a nurse do in the hospital? He or she places a patient close to the window. There is a prominent clock there. There's a calendar there so that the person is oriented to time, what is happening, what time of the day it is, what is the time. So that helps a lot in keeping the person oriented. It is important to have a moderate level of stimulation during the daytime. The room should not be unduly quiet and dark, nor should it be too bright and noisy, because both of these can precipitate delirium. And it is important that the sleep wake cycle is maintained. That is, the patient does not sleep during the daytime and then remains awake in the night, because most of the time delirium is precipitated in the night time. Then the nurse encourages the patient to wear his spectacles, hearing aids, etc., so that he or she is connected with other people and the environment. And then the nurse encourages the person and the caregivers to replicate the same routine that the person is used to at home. At what time does the patient pass his bowel? What time he has his meals? When does he read his newspaper? What time does he watch televisions? Is it possible to watch the same television programs in the hospital whenever it is possible? In whatever manner it is possible, the nurse will encourage the person to follow the same routine. And that greatly helps. And as soon as the patient is recovering, the nurse will encourage the person to ambulate, to walk around, and also regain the activity level that the person had before admission. Also, the nurse will regularly monitor the patient for any signs of impending delirium. This he or she does using what is known as bedside tests, mini mental status examination, where certain questions are put to the patient, and depending on the answers, a scoring is done. And if there is a drop in scoring from the level at which he was admitted with, one can reasonably suspect that delirium is setting in. And timely measures can be taken to prevent its worsening. Even if delirium develops, the same measures are continued, and sometimes the geriatrician might opt to use some medication to calm down the patient in case the patient is very agitated.